Well, health insurance companies are paying for COVID-19 testing, but that doesn't mean that all the red tape has been cut out. Once someone tests positive, the question of what's covered begins to emerge. In-network, out-of-network, surprise billings, all confusing terms that make insurance coverage very hard to decipher. We will help sort out the gray area by talking to a healthcare analyst. Next. Well, insurance companies have agreed to cover the cost for coronavirus testing, but as always, the devil in the details, and there is a worry that if someone is infected with the virus, that insurance companies will not honor costs that are not in network. Clearly, health insurance is kind of confusing, even at the best of times. Here to help sort it all out with us is Seth Denson. He is a healthcare analyst, and I hope he can simplify this because what they're saying, Seth, is that, look, we're going to cover the coronavirus test. Beyond that, maybe.
Well, that's right. We don't really know. I mean, the reality is most insurance companies are going to cover the vast majority of what treatments might be received. But if you'll remember, before the coronavirus became a thing, there was a lot of talk surrounding things like surprise billing. This is where you go to an in-network facility and you end up being seen by non-network providers and months later get a surprise bill for tens and sometimes thousands of dollars. So this is something that is concerning. It wasn't addressed in the legislation that was passed last week, is how insurance companies who do have to cover the test, how they have to actually cover treatment if it's needed.
Yeah, and I'm curious because, you know, you look at all these different things they're throwing into the system, right, Seth? We just had Governor Andrew Cuomo is walking around these areas and they're building makeshift hospitals. They're bringing in ships. They're going to be hospitals. And you have no idea. You might end up in some makeshift hospital. You might end up on some ship, clearly out of network, clearly out of who knows what. And then what happens down the road? That's the whole point is some of these people are going to get hefty bills, I would imagine.
They absolutely could. I mean, I've looked, and I haven't seen the Javits Center on any in-network list lately. So, you know, the concern here is what happens when. Because if they are going to house people in the Javits Center or anywhere else for that matter, who are the doctors that are going to be treating them? Is the insurance policy going to cover it? Are we going to see a sea of red tape down the road?
I'm curious also, Seth, am I covered? I mean, if you're an employee health coverage, right? Is that a different animal here, or are we kind of talking about the same thing? Do I have different coverage than somebody else who's worried about this?
Well, you could. So it's estimated that roughly 100 million Americans are covered by what are called self-funded health insurance plans, which means that while your employer might utilize a Blue Cross or United Healthcare or Aetna to manage the plan, the employer actually gets to set the parameters. And so long as they're in compliance with the Affordable Care Act and ERISA, they can really have the plan do whatever it needs to. And so it's very important that you reach out to your plan administrator and find out exactly what your plan does and doesn't cover.
So you mean beforehand? You mean before any symptoms, before any of all this stuff, you need to know right now what you are covered for and what you are not. And with what's going on, you think your health insurance provider is just going to call you back and tell you exactly what you are covered for and what you're not?
Well, I think we should all know, right, at least if our plan is going to cover this and how. And likely the plan's going to cover it because it would cover pneumonia or anything else I got done at a hospital. But we should ask our healthcare administrators exactly how it plans to cover it if I'm sent to a facility that may not be in network. These are important things Americans should know now.
I'm curious because, you know, we talked about New York Governor Cuomo. You know, he's kind of making these makeshift hospitals. He also has this other thing that he wants to do with nurses who work for healthcare companies. Listen, and I'll get your response on the other side.
Health insurance companies employ many nurses, doctors, etc., in the insurance business. We're saying to the insurance companies, we don't need them in the insurance business now. We would like them to help in hospitals, because this is not about assessing insurance claims at this point. This is about saving lives. When we get to assessing insurance claims, we can handle it then.
So they're saying, okay, back on the front lines to a lot of doctors and nurses. How's that going to go over?
Well, you know, at the end of the day, I think it is. We are in in a place where we're all hands on deck, right? Everybody wants to help and do their part. But the reality is we do have to open our eyes to what will be the financial impact of this. And many of those doctors and nurses, by the way, that work for insurance companies, they're there to help patients so that those patients don't flood the hospital systems for maybe not having coronavirus.
Oh, I didn't mean the doctors didn't want to be a part of it. I'm sure they're eager to get back in the front line. What I'm saying is the health insurance companies that are losing all these resources might be 2 steps behind going forward.
Yeah, and that could be a challenge. Let's not forget that healthcare hasn't stopped. Just because the coronavirus is here, there are people out there right now needing to access the healthcare system for a whole wide array of other issues, right?
Yeah.
So we have to make sure that we're putting those into balance.
Seth Denson, good of you to come on. Thank you, sir.
Thank you.